Hello, my name is Rebecca and I am a nursing student in the Community Living Center. I am going to present a patient to you. Patient is 74-year-old Caucasian male. He served in the Navy in the 1920s and worked at a lithographic company thereafter. Patient is married with 2 grown daughters. His wife visits him daily. Patient was admitted to the Veterans Affairs Hospital in November of 2015 after his doctor diagnosed him with bladder cancer during a regular checkup. Patient had no pain. The tumor was scraped out in December of 2014 and he was discharged. Further treatment included both chemotherapy and radiation until patient lost 25 pounds, all of his hair, and got extremely sick. Patient collapsed at home on January 26, 2014. Patient was then admitted to the Veterans Affairs Hospital again and chemotherapy was stopped. Patient began to improve. Patient states that he continues to feel weak. Vital signs are stable, blood pressure 114/57, heart rate 78 beats per minute, respirations 16 breaths per minute, oxygen saturation 100% en room air, and temperature 97.1 degrees Fahrenheit taken orally. Past medical history: 2 myocardial infarctions, stroke, seizure, abdominal aortic aneurysm, concussion, Parkinson's disease, depression, and anemia. All immunizations are up to date. 2 known drug allergies include augmentin and clindamycin. Past surgical history: abdominal aortic aneurysm surgery, 4 cornea transplant surgeries in the left eye, cataract surgery in the right eye, 2 balloon angioplasty and stent surgeries, and finally transurethral resection surgery. Patient is on numerous medications for depression, hypertension, blood clot prevention, constipation, high cholesterol, and gastroesophageal reflux disease. Functional assessment: patient denies alcohol and drug use. Patient denies any sleep disorders. Patient claims that he eats very well. He states that the cooking here is the best. Patient walks on the treadmill and uses an arm bike during physical therapy. Patient also walks around the unit. He is trying to quit smoking through use of nicotine patches. Patient currently wears a 14 milligram nicotine patch each day. Patient uses a wheelchair when leaving his unit. Psychosocial: patient lives with his wife in Ann Arbor. Patient's wife visits him daily. Patient says that he wasn't in a good mental state when he arrived at the VA, but now he is doing well. Patient has depression, but with treatment has become strong-willed, positive, and extremely thankful for his caregivers. Patient denies any outside stressors. Patient has a strong faith base. Patient welcomes visits from the chaplain. Family history: patient's mother had lymphoma and is now deceased. Patient's father died of colon cancer. Patient's paternal grandfather lived to be 100. Review of systems: cardiovascular. Given patients multiple myocardial infarctions and high blood pressure, it is essential to assess his cardiovascular function. Patient experiences no chest pain. Patient recalled that prior to his myocardial infarction in 2002, his left arm went numb, but patient is currently experiencing no numbness in his jaw or arm. Patient feels fatigued when he exercises. He can walk about 200 yards without feeling distressed. Patient has no problem laying flat. Examination: patient had no heaves or lifts, and no lifts or thrills were palpable. Patient had no abnormal heart sounds. When patient moved to left lateral recumbent position, an S4 sound was heard at the apex. This sound is related to patient's repeated myocardial infarctions and to his hypertension. Review of system: peripheral vascular. Given patient's abdominal aortic aneurysm, history of tobacco usage, and mainly sedentary lifestyle, a peripheral vascular exam should be performed. Patient experiences no pain in legs, calves, thighs, or hips while walking. Patient has no edema, hair loss, or coolness of lower extremities. Patient has no history of blood clots or varicosities in legs. Examination: patient's lower extremities have no color or temperature abnormalities. Patient has no edema, ulcers, or varicosities. Hair is evenly distributed. Patient's pulses were evaluated: temporal 2+, carotid 3+, brachial 1+, radial 2+, femoral 1+, popliteal heard with Doppler, posterior tibial 1+, and dorsalis pedis 1+. With palpation, patient didn't experience any tenderness. No edema was present and there were no varicosities. Temperature was symmetrical and warm. Capillary refill was brisk within 3 seconds on both patients' fingers and toes. Pertinent system number 1. Neurological. Patient had a major concussion when he was in the Navy in 1922. His head was permanently deformed due to a 20-pound block of steel dropping directly on it. Patient claims that this felt like an explosion. This incident has been evidenced throughout his life based on his seizure in 1981 and stroke in the early 2000s. In investigating recovery from stroke, a qualitative study, it was found that post-stroke patients' physical and emotional well-being has declined compared to the pre-stroke period. A decline in physical and emotional well-being could result in increased anxiety, increased nicotine usage, and decreased exercise, all factors that affect cardiovascular performance. The neurological and vascular systems are related due to patient's stroke. Since a stroke occurs when blood flow to the brain is obstructed, patient's cardiovascular or peripheral vascular system could be affecting his neurological functioning. Pertinent system number 2, musculoskeletal. Because of patient's risk for blood clots, high blood pressure, and his history of 2 myocardial infarctions, it is important to examine his musculoskeletal function. Patient's past medical history and new sedentary lifestyle due to cancer treatments provide for possible muscle deterioration as a result of decreased cardiac output. Mr. H's muscle function relates directly to his cardiac output. According to the concept of risk as applied to cardiovascular disease, an article featured in the Journal of Cardiovascular Nursing, physical inactivity is a biobehavioral risk factor for cardiovascular disease. Patient has been experiencing a decrease in physical activity as a result of his cancer treatments. Decrease in physical activity results in muscle deterioration. Therefore, it is important to perform a musculoskeletal exam to assess patient's muscle function.